Ladies and gentlemen, Dr. Lewis here. Again, another eye-opening video on chronic conditions, basically the metabolic syndrome. Now, I am an advocate of preventive care more than the curative care. And in this case, I know fixing the kitchen will fix that metabolic syndrome, and therefore diabetes, hypertension, obesity, and those chronic conditions that come as a result of diets will disappear when you fix the diet. Let us leave dietary conditions to be fixed by diet. That does not mean I'm neglecting the use or the essential role that drugs play in these conditions. Most of you have survived diabetes and hypertension through drugs. We do not dispute that. However, personally, I consider drugs to be the last option in therapy for chronic conditions. In today's video, I am going to highlight and explain to you how drugs of diabetes work, and we will use that to question if at all this therapy is supposed to be long-term. Okay? So enjoy this video, and you can put into the comment section whatever myths that you have experienced. If you're a diabetic patient, if you suffer from hypertension, if you are taking care of a patient or a relative who is suffering from these chronic conditions. Now, I also want you to share this video widely and large, be it on Facebook, be it on WhatsApp, be it on Telegram. Share it wide so that it can reach those people who require it and those people who are diabetic or suffering from the chronic conditions and the metabolic syndrome. So welcome. Most of the time, when the healthcare system, your doctor, your hospital, is trying to manage diabetes, most of the times they are managing hyperglycemia than managing diabetes. We will get to that. We will get the reason why I'm saying that. Now, even when you go to the lab to test for diabetes, what the lab technician does is he takes a blood sample from your system, then takes a blood glucose test. Now, that is where the challenge comes in, because how sustainable is a blood glucose test when you're trying to ascertain diabetes? Now, most of us know that diabetes is high blood sugar levels. Mistake number one. Because high blood sugar levels is what we refer to as hyperglycemia. And high blood glucose levels can come as a result of either one, you've taken in a carbohydrate-rich diet, or your system is also breaking down protein and fats to give you glucose. And therefore, the amount of glucose in your bloodstream starts to rise. Remember, this is the bloodstream. And in bloodstream, we have a specific amount of blood glucose level. So here, there is always a maintained level of blood glucose levels, which is called the normal range. Now, beyond that, on the higher side, you get into hyperglycemia. On the lower side, you get into hypoglycemia. Now, anytime you consume a carbohydrate-rich diet, you will break it down in the mouth to get glucose, and that glucose will go into the bloodstream and start rising the amount of blood glucose levels. So the level starts to rise. When that level starts to rise, then that is hyperglycemia. Unfortunately, what we go to the laboratory to test is hyperglycemia and not diabetes. So I want you to understand that the difference between hyperglycemia and diabetes is hyperglycemia and prolonged hyperglycemia is actually a symptom of diabetes. What is diabetes? Diabetes has to be an excess amount of glucose in your body cells. Understand that this carbohydrate that you've eaten, once it's broken down and it is absorbed as glucose, it goes into the bloodstream. Then it starts to raise the level of blood glucose levels beyond the normal value. Once it goes beyond the normal range, then the body instructs the pancreas to bring in insulin. So insulin comes into the bloodstream. This is insulin. And the reason why this insulin is coming into the bloodstream is because its intention is to take this rising amount of blood glucose levels into these cells. So number one, insulin opens up the gates in these cells, the fat cell, the liver cells, and the muscle cells, so that this glucose in blood is sent into the liver cells to be stored as glycogen or to be sent into the muscle cells. Those are skeletal muscle cells. And if you're working out, if you're walking, you're involved in the gym, that glucose is converted to ATP to give you the energy that these muscles require. Also, excess of this glucose, let's say the liver stores for glycogen are full, and that muscle cells do not require, they are not active. And therefore, you need this excess amount of glucose to go somewhere to be stored. So it will be converted into fat and then pumped all the way into the fat cells for storage. Now, the body likes fat. And the reason why the body likes fat is because it is preparing for an emergency. Remember that 1 molecule of fat carries 9 kilojoules or kilocalories of energy. 1 molecule of glucose or that carbohydrate will carry 4 kilocalories. So that tells you that fat has the highest amount of energy than the carbohydrates. Now, that is important because since the body knows that there might be an emergency, you might end up fasting, you might end up in a drought, or you might end up into a medical condition that will require you not to have the appetite to eat the carbohydrates, and therefore you'll have to burn the fat. That's why when you go sick, you lose appetite because the body tells you, hey, there's an excess amount of fat and I need to burn it. So do not give me any food. That's how appetite goes. And then you start burning fat. So the body is already preparing for this emergency. And through storage of fat, glucose in form of fat, then that's how the body prepares for that emergency. Now, when you burn this fat, for instance, when you're fasting, your body turns to burning this fat to give you energy. Then pumps this glucose back into the bloodstream for you to get energy. So fat can be converted into glucose and pumped back into the system to help you function. Also in the liver, we have glycogen that can also be converted into glucose and pumped into your bloodstream. This happens when you're fasting. And that's the reason why it is hard for you to go into hypoglycemia when you are fasting, because these two have enough glucose levels, stored to help you balance the blood glucose levels. That is not a point for today. A point for today is you have these cells. So the glucose that is coming in, you consume carbohydrates, the glucose comes in, and then the pancreas produces insulin. Insulin pumps this glucose into these cells for storage or in the muscles for activity. Now there comes a time when all these cells are filled with glucose. So all your body cells are filled with glucose, and therefore they lack the capacity to take in more glucose. When you keep consuming those carbohydrates, this rising amount of glucose will keep rising because it doesn't have to go anywhere. There's no storage space for that glucose. That is the point where we call insulin resistance, because now, even if the pancreas is producing insulin, and this insulin is purposefully intended to pump this rising blood glucose, so this is glucose, into these cells for storage, there is no storage. This happens like a refrigerator. You have food stuff in the refrigerator, and then you come again with new food stuff you want to load in the refrigerator. Unless you empty that refrigerator so that you can load in new food, you will have a problem. That is the same thing that is happening here. So unless you empty these storage stores, for glucose, then you'll never have space to store the new coming in, the glucose that is coming in as from the carbohydrate that you're consuming. Now remember, 90% of your plates are carbohydrates. Somebody eats tea in the morning that has milk. Milk has carbohydrates. You take tea plus sugar, that is carbohydrates. Then at lunch hour, you're snacking on fruits, that is fructose and glucose. You're also eating possibly ugali or rice and chapati. Those are carbohydrates. In the evening, you're taking another tea. At night, you're taking ugali. Those are vegetables. Those are high in fiber. Those are just carbohydrates. So you're loading your system with 90% of carbohydrates as the diet, but you still call it a balanced diet. So what you're doing, you're topping up to what you're eating in form of carbohydrates. You're increasing the level of glucose in your blood all the time. You're spiking the insulin that is coming from the pancreas all the time. So your blood sugar levels are always high and your insulin is always high. Then this insulin helps you to pump that glucose into storage forms in the liver as glycogen, into the muscle cells, and into the fat cells. And then every time, maybe after 7 to 10 years, your fat cells, your muscle cells, and your liver cells are filled with glucose that they cannot take in any more glucose. Now, just like you have a huge basin, and in this basin you have water, and on this water there's a surface, there's a jar that is floating on this surface of this water. Now, you start pouring in maybe a solute, let's say maybe salt or even sugar. You start pouring in this jar. Then as the jar fills, you keep on pouring in. They will reach a point this jar is full. And therefore, the more you pour the sugar, this sugar will spill back all the way into the basin to start concentrating this solution that is in the basin. This is the same concept that is happening here. So what you're doing, as you continue consuming those carbohydrates and those processed foods, you are loading up your blood levels of glucose. You are then straining the pancreas to give you insulin every other time, and that's why the pancreas might end up failing. And this insulin is struggling to take this into these cells. However, comes a point when this jar is full. So comes a point when these cells are full. When they are full, they cannot take in any more glucose. And what happens? The excess amount of glucose that is here starts spilling back into the bloodstream. Now, at this moment in time, when this starts spilling back into the bloodstream, that is when you go to take a blood sugar test and you get chronic elevated high blood sugar levels. That is hyperglycemia. Now, the point is, if you go to the lab and take a blood glucose test and it tests normal, it does not mean you are doing fine. It only means either your pancreas is still active, so insulin is being produced in its adequate amounts to help you pump that into cells. Number two, either your cells are not filled with glucose so they can still accommodate more. So you'll never find this level being high. But remember, these are just building up. So you're not exercising, you're living a sedentary life, you're consuming carbohydrates. So these are building up. And as they continue building up, you're growing that pot belly. You're growing that fatty liver. You're growing that fat. So once you grow that big, that is where you're headed to metabolic syndrome and obesity. Now, so you're testing for blood. Most of you will tell me, you see, I'm fat, but when I go to the lab, I take a blood sugar level, it's normal. It is not. What you're taking is, you're taking this, the blood sugar levels, but you're not measuring the amount of glucose that is stored in the cells. And that is the challenge with the lab tests for glucose, for diabetes. They concentrate more on blood glucose levels rather than the body glucose levels. And that is a problem, because this can fool you. Because if you consume carbohydrates, this goes up. If these are filled, this goes up chronically. Okay, so sometimes you can take that test and it turns okay, and you feel you don't have diabetes, but in real sense, you have pre-diabetes because these are loading with glucose. Until the day they are filled, that's when you'll have an elevated, a chronic elevated blood level of glucose here. Okay, so that's the reason why HbA1c level, that HbA1c test is very important, because this one measures the amount of glucose that is attached to red blood cells. So this is glycation, measures the amount of glucose that is attached to all red blood cells. And that gives you an average of like 3 months. Again, another one that is the C-peptide, which basically measures the protein. This is a protein that is produced the same time we produce insulin. So that will tell you, if you have an elevated C-peptide, then of course you're producing, every time you're producing a high amount of insulin, and that can lead you into problems, okay? So if you're taking alcohol, you're taking processed food, the wheats, they can also affect your pancreas. So you've heard of pancreatitis. So once you start killing the pancreas, then your insulin levels are altered. Then therefore, you'll never control your blood sugar levels. Number two, if you continue taking alcohol, you're altering your liver, because this goes into a fatty liver. Once it goes into a fatty liver, it cannot process glucose. And therefore, if you kill the liver, then you go into insulin resistance. Definitely. You will go into a fatty liver, you'll go into insulin resistance, and you'll start spilling glucose back into the system. That is diabetes. So you'll never control this. So alcohol in all forms has to go. Now, we were not here to talk about alcohol. We were here to talk about the challenge that comes as a result of tests, the glucose tests or the diabetes tests, which measure the amount of glucose in blood rather than the amount of glucose in cells. And number two, diabetes drugs. So diabetes is the amount of an increased blood, the body glucose levels, not the blood, because the blood is just a symptom. So most diabetic drugs or the therapy, even insulin, they treat the symptom of diabetes and not the cause of diabetes. So the cause is basically in the diet, okay? And diabetes is in your cells, is not in your blood. The blood glucose level is hyperglycemia, and that is a symptom of diabetes. So please understand that. Now, drugs for diabetes, let's say like metformin. Metformin is a standard drug for both prediabetes and diabetes. It's a standard drug for every person who is suffering from diabetes and also pre-diabetes. So what metformin does is, it increases sensitivity of insulin to these receptors. Remember, before insulin, how does insulin work? We've already talked about insulin in a video, but I'll give you a recap. Insulin, on these cells we have receptors, insulin receptors. So these are just like the key, they accept the insulin. So insulin comes in and binds on these receptors. Once it binds on these receptors, what it does is it opens up gates. So the gates open up, glucose gates, so that this glucose flows through these gates into these cells. Okay? So when you have insulin resistance, it means these receptors are not sensitive to the insulin that is coming in. So metformin, what it does is it increases sensitivity of insulin to these receptors. Now the challenge comes here. By the time you are diabetic, these cells are already full with glucose, and therefore they do not have any storage capacity for glucose. Now, this insulin, however much it will bind to these receptors, it will not be able to open up these gates because there is no storage for glucose. So this glucose will keep on rising. Also, the insulin will keep on rising. That's the reason why diabetics have hyperinsulinemia, because this insulin is supposed to take glucose into the cells, but there is no storage, and therefore glucose levels in blood keep on rising. Same to insulin levels in blood keep on rising. Now, you will reach a point that you want to augment this insulin by giving an external insulin shot. The external insulin shot does the same function to insulin. However, the question will come in this way. If the role of this insulin, even the external insulin, is to pump this blood glucose into cells, where will that blood glucose go to if these cells are already full? And when you're diabetic, these cells are full. So by the time you're going to receive that insulin shot, where is it supposed to pump this glucose to? We know of the phenomenon of the suitcase. It has, if you fill your suitcase with clothes and then you're struggling to lock it, but you're still adding in more clothes, it will end up rupturing. That is something we will explain when we get to the organs that are affected by sugar. So insulin therapy is a little questionable because even if you continue, you'll keep on pumping this glucose into these cells and they'll reach a point they cannot take it anymore and they'll rupture. That is where you start having that blindness on all these issues that happen as a result of damage of organs due to a rising amount of blood glucose levels. And therefore, diabetes is fixed in the kitchen. And drugs will only help when it is chronic, when it's severe. Drugs like insulin can only help when you have DKA. So which means you've been having this issue already, or HHS. Which means your cells are already full, and therefore we're just trying to help you manage this symptom. So these drugs are treating the symptoms and not treating the storage form and the cause. So the cause of diabetes is in the diet. And that is what I want healthcare professionals to start focusing on. If your doctor is focusing on writing that prescription to give you those drugs, then it's high time you just fire your doctor. Because if you fix this, let's say you block absorption of the intake of carbohydrates, what will happen is, number one, insulin levels will go down. So you'll lower your requirement of insulin from the pancreas, and therefore you'll not overwork the pancreas. That is one. And therefore, if insulin is going down, that tells the body that, hey, this guy is not taking in carbohydrates, therefore we have to shift our energy mechanisms from what we have been eating to what we have stored. Okay? So, this insulin, when it goes down, because remember, insulin blocks you from burning fat, because insulin is a storage hormone. So it takes it stores it, so you'll go fat. And it is called an anti-lipolytic hormone. So it blocks breakdown of fat to give you energy. So once insulin is high, you'll never shed that weight. So fasting or blocking carbohydrate intake helps you focus on insulin, lowering insulin levels. Once you lower insulin levels, your system starts utilizing this glucose in blood, clears it up. Once it does that, then it turns into the liver to break down glycogen. Clears that glycogen, then it turns back to fat cells to start breaking down that fat and give you glucose or ketone bodies, which are healthy energy sources of the body. And this is what happens when you're fasting. And that's the reason why diabetic patients should fast. The system will not tell you this because they want you to be a slave to drugs. So it's up to you to get this information and use it. Your doctor will not tell you this because he wants you to be his customer or her customer. Okay? So you will sustain his... Remember, they also need to pay bills. So you will sustain their bills for as long as you're going back to that consultation room to take those drugs. Because he will only change. He'll now go ahead and add on here the glibenclamide. Add on another drug, okay? Maybe sitagliptin. And these are drugs that will kill your pancreas because sitagliptin has been associated with pancreatic failure. So these drugs, diabetic drugs, if you're taking diabetic drugs for more than 6 months, you are the problem because you have no idea of what you're doing to your cells. Stop taking that carbohydrate because you don't need carbohydrates for energy. I already told you that fat cells contain a lot of energy more than the carbohydrates. So start burning fat to get energy. And the only way to burn fat is to lower your insulin levels. And the only way to lower your insulin levels is to block or stop yourself from consuming carbohydrates or start fasting. So that's how you recover from this. Now, this is a blood vessel. And this blood vessel supplies blood to different organs in the body. So you've already realized that these drugs will only treat the symptoms and not the cause and not the storage. So for you to clear here, you have to go through the kitchen. Okay? These drugs have to go. Now, so this blood vessel is supplying blood from maybe the heart to different organs in the body. The eye, the heart, the kidneys, the brain, nerve cells, everywhere. Muscle cells, the liver also. This is carrying glucose to these organs, is carrying energy and nutrients to these organs. Now, number one problem is, the reason why we do a HbA1c is because we want to measure the amount of glucose that is attached to red blood cells. And these red blood cells are the ones that are carrying oxygen towards these organs. So you know, if you pour tea that has sugar on the table, leave it for some time, when you come back, that table is sticky. That is the same concept that happens here. If your blood glucose levels keep on rising, they keep on attaching to red blood cells. Okay? So they attach to red blood cells. And when they attach these red blood cells, they become sticky. And they become sticky, this one can stick on this blood vessel wall. Once it sticks here, it starts to attract other cells. And therefore, these cells start to accumulate here and they start to grow. Once they grow, it forms a lump. And this lump is basically exerting a lot of pressure on the blood that is here. So that means there will be a lot of pressure that is required to pump this blood through this blood vessel. This development of this lump is what we call atherosclerosis. Okay? So you block. So sugar is the cause of atherosclerosis and not cholesterol as you've known. So if you block this blood flow, then you increase the blood pressure. So that is hypertension. Again, this lump can break. Once it breaks off, it joins the bloodstream and goes all the way to those smaller capillaries that are supplying these organs. And therefore, it blocks them. Once it blocks them, nutrients cannot go into these organs. And what happens? If you deny the eye the nutrients that it requires and oxygen, then the optic nerve starts to die. Once it starts to die, you start losing your eyesight. So that is how sugar is dangerous. When you deny blood flow towards the kidneys, they start to fail. So you'll have uncontrolled blood pressures. When you deny blood flow towards the heart, you have that heart failure, the coronary heart disease. So you'll have heart attack and heart failure because the muscles of the heart are dying because there's no oxygen and there is no nutrients because you've blocked that blood vessel that supplies the heart. When you block the extremities, let's say the leg, when you block blood supply through this sugar, you block blood supply to the legs, what happens is there is no nutrients and oxygen supply towards the leg, and therefore that leg gets infected because of ischemia, starts to rot, there is necrosis, then it gets infection, and then you end up getting an amputation. But I want you to remember, you're getting that amputation when you're still actively on insulin therapy and metformin therapy, the diabetes drug therapy. So why are you getting that foot capped off when you're still on these drugs that are supposed to help you reverse diabetes? Most doctors still carry the thought that diabetes is irreversible because they don't have an idea of fasting. They don't advocate for fasting. They also don't have an idea of what is causing diabetes. So most of them are just treating what they don't know. And that's why they'll tell you hyperglycemia is same to diabetes. So they'll define diabetes as high blood glucose levels. So high glucose, the reason why I talk against sugar is because sugar is a very serious problem in all your body organs. Okay? I am not denying the fact that DNA is made up of sugar. However, the sugar that you're adding into your system is not the same sugar that makes DNA. Glucose is not ribose. It's not the same glucose, the same sugar that makes the DNA. They're not the same. So don't get it screwed. Now, so if you're blocking blood flow through the formation of this lump, remember we are forming a lump here which is atherosclerosis, and the blood flow is altered towards these organs. So what do you get? You'll get blindness because you've affected the optic nerve and therefore you don't see. Also remember, sugar and diabetes kills nerves. So it will kill the optic nerve, therefore sight will be a problem. So for you to regain your sight, you have to start blocking what is causing this. And what is causing this is not through insulin or metformin, those drugs for diabetes. They will not treat that. What will treat that is you editing your diet. And you can go on a carbohydrate-free diet. If you are aiming to achieve a reversal in any of these conditions, those numbness in your legs, that nerve problems again, that blood vision, that loss of memory, the brain issues, the kidney issues, hypertension, okay, high uric acid levels, high creatinine levels. If you're aiming to reverse heart conditions and eye problems, then definitely aim at reversing what you're eating, which is causing all this. And what is causing that? Sugar in all forms. So stop consuming carbohydrates. And a carbohydrate-free diet is healthy for those people who are in this condition. Actually, a keto diet, which has basically, if you have carbohydrates in that diet, has to be the vegetables, which are high in fiber, okay? But all the rest, every ugali, chapati, all these spaghetti and processed foods, they are not essential. They are empty calories. Your body is always trying to figure out the next meal. That's why it sends you into cravings, because it wants you to bring in new food so that it can tap into these sources. So once you block this blood flow towards the eye, you'll have the eye rot, which is blindness. You block the heart, you'll have coronary heart failure, and you'll have that stroke and that, no, not stroke, you'll have coronary heart failure and the heart attack. When you block the kidneys, you destroy the kidneys, then this is where you start going for dialysis. And remember, those people who are going for dialysis are still on insulin. That tells you this therapy is not working. So if I told you have to reverse that kidney problem, then of course, drop the insulin, because hyperinsulinemia is the #1 cause of kidney problems. So if you're adding on that insulin therapy to the already existing insulin, then you're causing hyperinsulinemia, and then you get into kidney problems. Once you get into kidney problems, they start telling you do not eat salt. Yet they're not telling you not to eat sugar. So concentrate on eating salt and drop sugar. Then the brain rot, of course. People who are diabetic lose memory. You even know, if you take tea, an hour down the line you're yawning, you're getting this mental fogging, you're losing memory. The reason that is because sugar is affecting your brain cells. And that's why I tell people that brain cells do not prefer glucose as their energy. The reason why they prefer that is because what you're taking in is only carbohydrates, and therefore the end product as for energy is carbohydrates, is glucose. Brain cells can survive on ketone bodies. They take it and use it. Okay, so that is how you recover from that. Once you drop those carbohydrates and start fasting, your brain cells start to rejuvenate, that mental fogging disappears. Then the nerve problem. So this is where you get amputation, because once you start having nerve problems, then you get into issues with numbness, burning feet, burning hands. You cannot feel yourself, sometimes cold feet. Okay, and most of you have experienced that, and that is an issue with nerves. Again, remember, metformin is a drug for diabetes, and it blocks the absorption of vitamin B12. And vitamin B12 plays a very major role in brain function, in DNA production, and in nerve function. So if you're taking metformin, then you're altering absorption of vitamin B12, then you get into vitamin B12 deficiency. That's the reason why you're having those cold feet and that burning sensation and that tingling. You feel like somebody's pricking you. Then the leg, of course, when you go into dialysis, then you get an amputation because of nerve failure, and also because of infection, because your immunity has gone down. So diabetes has very serious implications to your health in general. Okay, both the macro and microvascular effects on your system. So I wanted to correct this, because if we focus on treating diabetes and not the symptom of diabetes, then we will recover from diabetes definitely. And I want most doctors to get this as a challenge. Share this to your doctor. Share this to most people. Let them know that diabetes is not high blood glucose levels. So they should not treat that, because these drugs, what they do, they are treating, they're trying to clear these blood sugar levels. But what we are not treating is the storage and the cause of diabetes. So I hope this video has been enjoyed. I hope you've learned something from this video. So start with yourself. Start fixing your diet. Start fasting. Once you start fasting, that continues, that goes. Focus on keto diets. Keto diets are very important. Low in carbohydrates. So these keto diets are the ones that will lower your insulin levels, and therefore you start burning fat. So that is how you recover from diabetes. And that is how we question the system about diabetic drugs. And this is what the big pharma will not tell you. This is what the food industry will not tell you, because as you continue eating their carbohydrates, you continue getting into diabetes, and therefore you'll continue going to the big pharma for these drugs. Once you do that, you end up in these conditions still on these drugs. And then you end up on these conditions, then you die, and we will tell you you died of blood sugar levels and diabetes. And we'll also sing to other people that diabetes is irreversible. Diabetes type 2 is highly reversible, and you can reverse it through the diet and fasting. Concentrate on that.